you have that really intense tension, the disc pops off when the jaw open and close, and the clicking and popping that patient complain of, well, it's self-reducing. The disc is popping back in. So then it gets to the stage where the disc doesn't pop in anymore, and you're rubbing bone on bone. And so that causes a lot of inflammation and tenderness.
So welcome back to The Body Behind the Mastery, where we explore the physical discipline, recovery rituals, and movement practices behind world-class professionals, from elite athletes to master artisan. I'm Mark, your physiotherapist, your host, and in today's episode, we're diving into something that most people overlook, the jaw. Our guest today is Dr. Baol, a dentist at Be Well Dental in Brisbane. She's known for not just her technical skills, but also her gentle, caring approach and deep focus on patient well-being. Together, we'll unpack the TMJ dysfunction, what it really is, what causes it, and how you can look after your jaw health, especially if you clench or grind or living a high-stress lifestyle. So, Dr. Baol, such a pleasure to have you here with us. You've had quite an inspiring journey from your early years in Vietnam and Malaysia to now calling Brisbane home and helping people smile every day. Before we get into TMJ, I would love to know what drew you to dentistry and what keeps you passionate about it.
Yeah. I was actually telling Phoebe downstairs before. I started dentistry early from... I've probably been in the industry for 30 years.
30 years.
A lot of my life. So I started as a child being very afraid of the dentist.
That's everyone.
Lots of layer. From bad experiences, but there was just layer of fear and shame.
Wow.
But that shifted, that changed around the end of high school when I started to work for a local dentist. And
you did start very early.
I know,
so
at the end of grade 11, 12, I started to do dental assisting.
Wow.
Sort of on the weekend after school. It just happened I was at the dentist and I was saying, I'm looking for a job in healthcare as a part-time. She's like, come and work for me.
Wow.
And then I did, and I really enjoyed it. I saw the other side of dentistry. So this dentist had a really great way of connecting with people. And she looks like she had a good time being a dentist. Like, she enjoyed her job.
Yes.
Her patient liked her patient trusted her. So that kind of shifted my perspective of what dentistry could be like. It didn't have to be the same as what I experienced it. And then while I was being exposed to the behind the scene of dentistry, I saw how it's such a craft. I've always enjoyed doing things with my hands.
Hey.
And then being able to see that you can, use science to repair something that's broken down and to build it up again into something that's beautiful and functional, that was really quite riveting for me. I really enjoyed that part of dentistry. So when it was time to choose what to do at uni, I knew what I wanted to do. I wanted to be a dentist because it encompassed connection, which I yearn for all the time. I like talking to people. I like understanding people. So then that just kind of paired really well. So I'm a doer, so I went and became a dentist and started working, and the reality of being a dentist wasn't what I expected. Early on, I became really stressed and anxious, all the time in my early years as a dentist. I was carrying a lot of emotional stress. I probably could, at the time, the technical side of things was okay. You can do continuous education, you can learn a skill, but I didn't know how to deal with the emotion because I learned how to do the dentistry, but I wasn't the same as that dentist I worked for. I wasn't happy.
Wow.
I was really stressed.
So not connecting to the patients as you liked?
I think...
Were you able to identify the actual stressor?
I did. I kind of just felt like I was putting a lot of pressure on myself to be perfect. When a patient comes to you, you want to do the best for them. You're dealing with their fear, pain, and expectation of treatment outcome. So any failure was a hard hit on me. And so that pressure to do and fix things perfectly just got a little bit too much. And at the peak of that stress, I was really lucky because I was invited to a mindfulness retreat. And it was ran by 3 nuns from Plum Village, which is a sort of Buddhist Zen meditation.
Yes.
And then one afternoon at the retreat, I was just observing them. And they were standing, the 3 of them, under the shade of a very ordinary tree, but they were admiring it. And from where I sat, I saw peace and contentment. And at that moment, within all the stress, that's what I felt like I was missing.
Yeah.
So being a doer, I left my job and I went to southern France and lived in that monastery that they're from for 3 months with them. So together we practiced mindfulness. We sat, we ate, we worked, we walked, we breathed together in mindfulness. And that experience sort of transformed me as a person, and that kind of filtered into my work. It just kind of taught me how to slow down, how to truly be present and be aware of my own needs and emotion, and just to know what I want as well, instead of always being driven to give other people what they need and want. So that's what led me to dentistry, and the dentist that I am today is very different to how I was when I first graduated. It was very procedural, very technical driven. Now when I sit with a patient, I really truly, I think I listen.
Yeah.
And when you listen deeply, you understand the person as a whole and not just the physical issues that they tell you about, but you're listening to their emotion, they're listening to their need, and there's that body and mind connection, which I think is really important in healthcare. And I think because I can do that now, I can deliver the care that feels more authentic and more healing.
Yes.
And that makes me happy and content in what I do as a dentist.
Yeah, that's so amazing. I think patients do sense that as well. When you're in the balance state, like patients do, that calmness do pass on to the patients. And when they feel that, or it filters down to them, that can actually positively benefit their health as well.
I think it's real because I think the energy that you channel is really important. Your presence and of being there is important because you concentrate better when you're present, and people can feel you more. So I think that's an important element of healthcare in general, not just dentistry. It's made work and dentistry, although dentistry itself hasn't changed, but for me, I've practiced it in such a different way that I think it's more sustainable and more enjoyable.
Yeah. Wow, that's so amazing. So basically most patients are anxious when they come in. So of course with a healthcare practitioner that are also stressed, that's like a recipe to.
So I was lucky. I think my journey has been really lucky to meet a lovely dentist that I was able to work for. And then in the peak of almost giving up on dentistry, I was invited to this lovely mindfulness retreat. And then I think to thank myself for taking the courage to leave my job and say, no, this is not how I want to not the trajectory I want to go on, and to stop and to take myself to a place where I learn to really be and be comfortable with myself.
Southern France. Wow.
It's beautiful too. So a really nice place to meditate and just really reflect.
Amazing. Now let's bring you back to today's topic with the TMJ. We often forget that dentistry is just about the teeth, right? It actually includes the whole system. I was talking to you before, you said there's also the posture, the jaw joint muscles, the whole lot. Now, can you walk us through exactly what is TMJ and what happens when it is not functioning properly? Yeah.
It's a complicated jaw because it's bilateral, isn't it? So to put it simply, it's this jaw joint here that sits just a little bit in front of the ear. It involves the skull and connecting the lower jaw. and you have two on either side,
Yes.
and they work together. When they work together, you can chew, speak, you can move your jaw. And for this, and generally you can think of the jaw joint as a sliding hinge. It opens, closes.
Yes.
It can kind of go forward and backward a bit and side to side. And for this to work smoothly, you have that cartilage in between the skull and the lower jaw, like a ball and socket. But you have that articular cartilage in the middle to act as a shock absorber. So when all this is functioning well, there's no pain. And surrounding this jaw joint, there's obviously muscles, ligaments, and nerve that help control the movement and stabilize the jaw joint. So all this, when it functions well, you can eat, speak comfortably. But when there's imbalances caused by either bruxism, clenching, grinding, and just holding tension, or if there's an injury or some imbalances, and we mentioned before, it's not just imbalances of the teeth, it's actually imbalances of the body. So say if you have bad hip or you've got feet problem, sometimes all of that can actually transfer up and then develop or manifest itself as jaw joint pain. And it is there, but often sometimes we start to get patient into that journey of treatment and going to see a body worker and sort out something else, and then that helps us sort out the jaw joint. So we often try to tell the patient that our body is linked. There's not really a single part that's individually by itself. So that's how the jaw joint function. And when we are off balance or when we hold tension and stress, that's when we can have pain, we can have clicking and popping of the jaw joint, or even restrictive movement, or sometimes some people get to the extent where it's locked.
And stiffness as well, that's so common. Well, that's it's interesting that we definitely see in physio a lot of people come in and they have jaw pain, but that you can see the rest of their body is reacting, or whether that's a cause or the effect. So hard to work out, right? Everything works as a system. And on top of that, there is the neurological pain on top of that, which is so common with the proximity of some of the nerve structures, like the facial nerve, the trigeminal nerve.
Yes,
that's a big
which has
one.
a direct connection to the brainstem, so you've got like no leeway. It's just shooting that pain up.
The
really
region is just so
quickly.
painful. It's so close to the pain spots, isn't it? That's something that we see in the physiotherapy space as well. I can imagine that you see a lot of these in your clinic. What are some of the common habits or causes that lead to TMJ? Like what make people develop these kind of problems from your perspective?
You're right. We do see it quite often because it's not really a single day that I come into work and I don't sort of see someone with not like at least one person with TMD, so TMJ dysfunction, whether they present with symptoms or no symptoms. But the majority that does come in with symptoms, they're usually experiencing myalgia, which is sort of like muscle overuse and tension. And we often see it manifest because of bruxism. So either where it's clenching, grinding, or holding tension. And I mentioned holding tension is you don't walk around clenching all the time, but you just have to be bracing. You just have to have that bracing and tension where you're holding that muscle, particularly the temporalis and the masseter.
And you can feel it, when you palpate or when you feel the muscles.
And you can also visibly see it when they come in because they're usually tense around the neck and shoulder, and they're holding that tension. They usually have a forward head posture. So that posture, clenching and grinding, they all kind of intermingle. But as dentists too, it's really important for us to differentiate between whether someone clenches or whether someone grinds. We feel like that's a bit different. Clench is this.
Yes.
And this is
Like
the majority
static.
of the patient is clenching, or that they do this. And it's when we tell our patient it's okay because it's normal. It's your body way of getting you ready to do something. It's the sympathetic nervous system working really well to kind of get you ready for a really busy life if you're a high achiever. But when that sympathetic nervous system goes on and on and on and on and it doesn't it doesn't stop, it causes your body to have a lot of strain. And that's when it fatigues and you get pain or dysfunction. So even though it's normal, we need just to kind of regulate it a little bit so that we can kind of help the patient. And then the grinding patient, we definitely need to investigate it, because grinding, if we see grinding, so if we see patterns of wear in teeth that suggest it's grinding and not clenching, and we look at the patient as a whole, say, do they have a low tongue posture? Do they have a bigger neck? Are they snoring? Do they have like weak tone at the back of their throat? Then we start to have alarm bell. Do this person have a sleep breathing disorder? Because grinding, on the other hand, is a body way of triggering the patient to kind of wake up and breathe. So if they're grinding, we don't just simply give them a protective splint. We want them to make sure that they're getting a diagnosis for any sleep disorder breathing or be cleared of it. So parking that aside, I do think it's really important to identify clenching or grinding. And then that kind of depends on what treatment we would take. But for most people, it starts off with intense stress. And stress, not just psychological stress, but postural stress or anything like that create that hold of tension. There's little habits like people who like to chew gum all day that also causes stress, or fingernail biting. So we end up finding a lot of things when we click in and see why are they holding tension here. But that constant tension that they hold in the muscle, well, the muscle then links to that ligament that hold and stabilize that jaw joint, that holds that disc in the middle. When you open, the disc slide with you, and then when you close. So when you have that really intense tension, the disc pops off when the jaw open and close, and the clicking and popping that patient complain of, well, it's self-reducing. The disc is popping back in. So then it gets to the stage where the disc doesn't pop in anymore, and you're rubbing bone on bone. And so that causes a lot of inflammation and tenderness in that jaw joint. Over time, this nice round condyle is not round anymore, it's flattened, and patients have really restrictive movement. So there's a progression. And where we want to pick it up is when patients have that early muscle fatigue, and try to sort that out before it transfers to the jaw joint and before you get any actual physical damage of the jaw joint.
Wow, that's very in-depth with the actual mechanics of it. How about the causes? In physio, we find that we treat sports population, and some of them with jaw problems is that their lower jaw actually retracts back, and that can actually give them breathing problems. It reduces their airway, and also it gives a lot of tension in the jaw segment when the jaw is in that backwards position. So do you find that there is a correlation between, like, this is what we find in physio, is that like the Asian population with a smaller jaw, a lot of them do get more of these issues versus some of the other people who might have like, the more wide jaw population is like less stress onto the whole segment. What's your view on that?
Oh, you're getting into this really controversial area of dentistry where, we think people with retruded jaw have poorer airway and higher risk of TMJ. So it comes, and it really boils down to, is it genetic or is it epigenetic or is it fully functional? Right. So we've got that kind of linear.
Well, through the aging process too, people's jaw changes in size and
it does. There's that genetic basis, but there's also a lot of function that determines where your jaw end up. Okay, so say if you're a child and you genetically you have a smaller jaw, and then you might have big tonsils, you might have a deviated septum in your nose, you might have allergies, so then you can't breathe through your nose. You start breathing through your mouth, and your mouth is like this all the time, and you're posturing your mouth open, your tongue is sitting low, and as you're losing your baby teeth and developing your adult teeth, your tongue is sitting low all the time. So what we like as dentists or as airway focused dentists is we like the tongue to be resting on the roof of the mouth.
Yes.
It
That's
acts
the
as a
normal resting
perfect
position,
template for teeth to come through to create that nice flat, broad, wide jaw that you're talking about in the palate. And that allows room for that lower jaw to develop and swing forward and grow forward. And basically it's not going to be trapped behind.
Yes.
But if you have an open mouth position like this, and your buccinator and your cheek is putting pressure this way, your tongue is down here, which is not on the roof, you start to have a very narrow teeth development. And when you have a narrow jaw, then the lower jaw is going to sit back because it sits behind that upper palate. So it's going away from TMJ, but it's a whole can of fish that even, they may be more progressive in America, but in Australia, we're still not, it's not really taught in undergrad or when I was in the undergrad. But I'm really sort of, passionate about it because my children are going through the same thing. And so that kind of, motivate me to learn more about it, about nasal breathing, about jaw development, and the importance of it all in the development of the jaw. Like, we don't eat like we used to. When we offer food to baby now, we give them soft puree instead of hard food. So we don't chew as a baby like we should. So the muscle development and jaw development, people's jaws are getting smaller. You're touching on it. It's a big topic to talk about because when I see kids young, I tell their parent, offer them solid food, early, give them an open cup instead of
so they can develop the musculature.
Yes, and it's hard, but breastfeed if you can. And if you can't, there's other alternative, but that should be the choice because it's a natural way for the jaw and the tongue to develop. And that sets them up. So they may have been a child that was bred, that fed on bottle, then went to puree, then went to sippy cup, and then had, say, allergies, breathe through their mouth, tongues completely on the bottom all their life, or maybe they're even tongue-tied. Then that kid might get a TMD problem. That kid is very predisposing to jaw pain. And then because they're mouth breathing all the time, that sympathetic nervous system, when we're mouth breathing, we mouth breathe because we're running away from something and we're scared and we need a lot of oxygen. But usually we should be breathing slowly through our nose where the air is filtered from the diaphragm to, trigger that vagal nerve interaction. So a child that mouth breathe, they're going to have that higher sympathetic nervous system that drive towards that. And so that's really going to set them up for pain, for chronic pain.
It's interesting how it is a multi-system thing, like what you mentioned from developmental side. It can be a trigger for TMD problems later on as well. And you mentioned vagal nerve as well. That is another big area that a lot of disciplines are looking to. From the physio side, vagus nerve is the longest nerve of the body. It goes all the way from the brain all the way to the feet, right? It supplies a whole host of things. But one of the biggest function is it does regulate, or it is connected to the stress and the tension level of people, and that is a big stressor in TMJ. So a lot of causes of TMJ in the physiotherapy space is to check out the ribcage. Apart from of course, you check out the jaw position, the neck posture, the forward neck posture, but the ribcage and vagus nerve is connected to all that. It courses through the neck, so changes in neck posture can press onto the vagus nerve and cause that dysfunction. So that needs to be corrected. And then the ribcage, the diaphragm, when diaphragm is tight, it actually inflates your ribcage. But rather inflate, I would say it makes the ribcage into a more like the raised position. It stays in that raised position. And a lot of the work that we do is to actually release those ribcage muscles. So the ribcage can actually come down, and that stretches the diaphragm back out. Most people think it's opposite. When ribcage comes down, the diaphragm is supposed to be tight. It's actually the opposite. Diaphragm gets relaxed when the ribcage comes down, and that comes together with your people needs to stay relaxed and breathe. Breathe properly.
Yeah.
And so it's all aligned.
It's so important.
Yeah, it's all aligned, and that's connected to the TMD as well. So let's move on to. Is there any other aspect that you want to you can cover with the TMJ that you feel we haven't covered?
What would you like me to cover? Because obviously,
Can we talk about the actual alignment of the teeth?
Yeah, sure.
Yeah. So a lot of people think TMJ is to do with a bite, right? When they get clicking, they feel like they're not biting properly. Is that something that is, that's obviously something you assess on a regular basis, right, in your practice. How do you find the prevalence of that? Like people actually, the TMJ is actually due to the alignment of the teeth. Is that intimately connected? Is that the main cause, or is that just the effect of having TMJ?
It really depends. I wouldn't say, definitely it's not the main cause. Teeth are just one aspect of what we described before. When the teeth close together, they're part of the process. I often do see that when you get misalignment, so when something happened to the dentition, so you've just had dental work done, or you had your wisdom teeth removed, you've had a crown or even a simple filling that's a little bit high, and you're having to avoid it all the time. So we call it in dentistry an occlusal interference. And if
that's the word.
Yeah. So an occlusal interference, and then your body, being a very adaptable system, will try to avoid that interference. And then that causes TMJ because your muscle, your ligament, and the joint is kind of deflecting.
Or you're just biting from one side to avoid.
Exactly. So
after wisdom teeth is taken out, I think everyone gets.
Yeah, but wisdom
TMJ
teeth,
problem.
it's not just that. It's the procedure, the mouth opening, and the pressure put on to remove the wisdom teeth. Actually,
and the amount of time.
Exactly.
The jaw stays in the open position.
And we tell our patient, we actually have a consent for long procedure that you may get jaw pain afterwards because there are just some dental procedure that needs to go long, and we often tell our patient this is going to happen, and it's very likely that your jaw is going to be tender after the appointment. It's part of our consent process, and we give patient rest in between. We use blocks and things like that to support the jaw joint.
It's so helpful.
Yeah, and post-op, we tell the patient, go on soft food for the next couple of days because the masseter has been open to rest the muscles. So that helps them recover, because if we don't give them that post-op instruction, they'll go on and do whatever, or like that night chew a steak on their brand new crown, and that just generate more pain. So we're very careful in giving post-op. So with that in mind, when you say bite imbalances or occlusal interference, I feel like it's usually triggered by an event. A dental event, like something happened or you had your mouth open for a long time. But if you grew up and you get sometimes you get interferences, and we like a crossbite and things like that, but it's very individual based. A lot of the time you start to feel like you can't bite down properly anymore, and there has been no dental influences, and all of a sudden you feel like you can't close, then it actually might be from some sort of spasming or I think mentioned before, you might have an imbalance somewhere else. You might have hip problem. You might have abdominal problem. So you said the rib cage before. I feel like a lot of problem is we stop using our abdomen properly. We're not getting enough good core strength. And then when we don't have the core strength, we start breathing badly too, because we don't breathe from our diaphragm, but we breathe from up here. When we're stressed and we're in that sympathetic mode, we're thoracic breathing. And that just pulls everything, and that causes your TMJ to flare up as well, because we find a lot of short, like chest breathing is one of the main causes that we get tension in this area. So at Be Well Dental, or our patient, when we identified, and we try to identify early that there's any dysfunction, whether it's muscle spasm, whether there's clicking, restrictive of movement. We measure patient range of movement as a norm. So we have a baseline. Mark, I noticed that 5 years ago when I measured it, it was a normal 50 millimeter opening, which is normal for most people. How come you can only open to 42 now? You know, is there tension there? So if you don't have a baseline, you don't have anything to go on. And sometimes we're so busy that we're not aware of our body. Most of your patients come in really tense, but they didn't even know they were tense maybe a year ago. It started early. When your body is in pain, it's that down further in that progression. So when we do detect that there's some dysfunction, we start to tell our patient that what we recognize, and we teach them the normal jaw resting posture. A lot of the population don't know what the resting posture for the jaw is, because they don't even think about resting their jaw. But you should be resting your jaw most of the time. If you're not speaking and eating, your jaw should be in rest. And that's tongue resting on the roof of the mouth, lips together, teeth slightly apart, breathing through your nose from the diaphragm. And I tell my patient to not just do this when you feel tired and tense. When I recognize that a patient is mouth breathing or not knowing where the resting posture is, I want them to practice it. And I ask them to set an alarm every hour. So every hour, what we're asking you to do and what you could try and do is scan your body. When the notification goes off, how am I feeling? Is my posture good? Is there tension in my jaw, my neck, my shoulder, or any other part of my body? So bringing awareness to your own body. And then I don't ask them to do anything. You don't need to fix it. You just return to this resting posture I teach you. Make sure you're sitting up comfortably, tongue to the roof, teeth slightly apart, lip together, breathing through your nose. 3 breaths from the diaphragm. And then just go back doing whatever you're doing. The next hour comes, do the exact same thing. And that retrain the neurological pathway to go back into that resting position. So that we're going to regulate that sympathetic nervous system. We're going to try and regulate it. And we don't have to struggle with it, but if we're diligent, if we're setting the alarm and we're scanning our body all the time and we're resting, and going back to that jaw resting position. And if patients have time, we actually tell them to extend that. So give yourself half an hour, lay down on the floor and do total relaxation. So do the same thing to your jaw, but you'll do this and you can start off with your eyes, closing your eyes, you send your attention to your eyes. I'm resting my eyes. Breathing in, I send my attention to my hands. Are my hands tired? I'm resting my hand. And you're resting your whole body. And that's a really good way, an easy way to activate that parasympathetic nervous system, get that pathway going again because it's been shut down.
Resting activation, yes.
So often we try to stay healthy by being more active, but we also need to set aside time to rest because that's what the body needs to do as well.
It's like prolonged sitting. Like we're taught at a young age, if you sit for too long, you need to get up and move around. And that is the basic concept of this, isn't it? Like the jaw, same thing. Like you just rest, you do your breathing. That is taking away from the tension state to the resting state. Like sitting for too long, you're taking, and you stand up, you're taking away from the tension state to the resting state as well. And we do that with people with posture as well, like from like set an alarm. So when you're sitting, every so often you check your posture when you at your desk, whether you started to slouch or sit up tall, reset your posture before you continue. So it's,
and when you ask people, they don't know because when a dentist asks, do you clench or grind? People are like, I don't think I do. And then I would say, do you think you hold tension during the day? Oh yeah, I work, I'm really stressed out, I've got this busy project. And so clenching to me is a very normal and common thing that we see in most people. and it starts during the day. And so at Be Well, we don't just give patient a splint because they clench, because that's not treating the cause.
Yep.
Clenching at
That could
night
sometimes
time,
make it worse too.
if you have sleep obstruction, if you have OSA, you don't want to. Splint is another whole bunch of. It's great. We do a lot of splints, but it's really important to identify which splint you need.
Yes.
There's a variety of them. They're not just they're classified in protective splint, and then there's therapeutic splint. And some therapeutic splint may just be used for a short period of time, and then the protective splint used to protect your teeth from breaking because you can't stop clenching, and also reduce the force on the muscles, but they're not treating a condition. So they're not treating a click, or they're not trying to recapture a disc, an articular disc that's slipped. So splint is another topic, and we're very careful in prescribing a type of splint for our patient. We don't do it until we know what the state of the TMJ is, the status, whether it's reducing or not reducing. So we're very careful in that. We do occlusal balance, so we make sure there's no interference, and we get them to go and see a physio or an osteopath. We want to make sure the whole body system is fixed.
Yes.
And we prepare the patient for a journey, because it's not a tablet you can take and go away, and it requires the patient's own diligence to do the work, to do the relaxation.
And the prevention. I think prevention is the big thing here, like everything.
Yeah.
Is like that's what. Now, if you don't do the work, it's going to slowly slip back to the original state.
It goes wanes, and
Yes.
when they're diligent and the stress level is low, it's generally better because it's less inflamed. There's less pressure on it, and then something happened in life, and then someone can have had really positive respond to treatment. Same with your physio patient. They're going really, really well. Something happened, and then it seems like they're back at day one. So whenever we're treating a TMD patient, we're there with them as a journey, and we take care of them as a whole, and we prepare for them that this doesn't just go away the next day. It takes work, it takes maintenance, because if you're prone to this, you're going to be prone to developing it again.
Yeah, symptoms, I find a lot of people, they do get that relief pretty soon, but then like what you say, it doesn't mean the problem goes away.
Yeah, we have people that get relief, and then they come in and it's like this. And we, dentally, there's things that we can do for acute relief. We use soft laser therapy on trigger points. So it's kind of like, sort of like dry needling, but with laser. So we do that for the patient. We can use Botox as a therapeutic measure to inhibits that tightness and reduce the muscle spasm. But I never tell my patient to rely on Botox therapy for TMJ. It's just not treating the cause. It's kind of masking the problem. And the two muscle we can get to with it is the masseter and temporalis. And when you deactivate them, you're just going to clench with your other accessory muscle, and we feel like the pain just starts to get into here.
That's if they don't follow the rest of the therapy.
Exactly. So Botox for me is just to kind of calm things down so that the patient can even rest. Because when you're in this much pain and someone tells you to rest, you just kind of look at them and you're like, you want me to rest with this headache? So we do. There's things that we can offer as dentists to really reduce that acute, intense headache and jaw pain. But for me, the shift is from the work that they do in terms of the mindfulness and awareness of the habits.
So it's like if you have tight shoulders, you get a release, but then you keep sitting like 10 hours at a time, it's just going to get tightened up again. You can keep having releases. It will help every time, but then the problem is still you need to change that habit.
It's a habit, and it's not just, it's the movement. We teach them to make sure they have neck movement exercises, and then the sleep hygiene to make sure they're not on their screens, after dinner, the blue light and the melatonin regulation of their body. So we want them to really have good sleep hygiene, like no caffeine, alcohol, And yeah, I think screens is a big problem because people don't realize that by being on the screen, it really affects their melatonin level. And we also for really...
With the blue light.
Yeah, so if I have to be on the screen, I try to wear my glasses and make sure that I'm blocking it out because it's not natural and the melatonin production is affected when you're on your screen and you don't have a blue light filter.
Most people don't realize the actual effect of that. That's actually huge.
Huge. And also the stimulant of the screen, whether you're on Facebook or the scrolling effects. So we were at this, I was at this conference with a kinesiologist and chiropractor, and he was just saying that that scrolling effects really affect the brainstem processing, or vertical processing. And so then I went home and I'm like, okay, kids, you're not having iPad anymore. You're not scrolling.
Especially those reels, the shorts.
The constant scrolling and the constant stimulation of the brain, and then nothing after that is going to give you that adrenaline rush or that endorphins of feeling happy. So less screen before bed is really important, and have a regular good, routine to go to sleep. For TMD patient, we also advise no exercising before bed. We prefer that to be done in the morning, so you're not highly sympathetic nervous system, really highly, we just want that wind down process. So, around depending on what time you want to go to sleep, just start winding down that process and have a routine so your body expects it. And then it just kind of clicks in. Try not to eat late at night and then have an insulin rush in the middle of the night. That's going to disturb your sleep. So it's really holistic way of managing things, and it requires that the patient is committed to just trying all of these things and have it in their life. But it makes for a healthier life. And with dedication, you'll probably be happier for it. You'll be more productive. So you think you're going to try and do this and you're like, this project nonstop. But I feel like not having breaks and not having time to be mindful actually slow you down because your brain is clouded and your body is fatigued. But if you have a nice rest routine, then the time that you actually dedicate it to work, it's going to be more efficient because you're high, you're focused. So that's what I try to tell my really busy patient who kind of hear these sort of stuff that I'm talking about, and they just think they can't do it. And so we just kind of slip it in a little bit at a time. We talk about just the jaw resting because that's really important for us. And then we add little bits and pieces in, and that kind of string everything together.
Over time, they get there.
Yeah, and it's particularly because they see the benefits. So we review them and they're like, the fact that you tell me to set an alarm and screen myself, I'm tense all the time, Baol. And that kind of reinforces, you do need to release it.
Yeah.
That's right. And so first bring awareness, and then we start to maybe take shift in the way we try to do things. So I think that's really important. Patient management is give people bite-sized pieces rather than overwhelm them with this whole treatment armamentarium that you've got, and then they can't do anything at all.
They'll get overwhelmed. Too much to deal with. Hey, Dr. Baol, I can really see that, you're so knowledgeable in this space, and I know it's difficult condensing all your knowledge in this short podcast. I can see that you are really summarizing a lot of things, a lot of these ideas. There's so much knowledge to it, and there's so much that you can expand. But taking that summary of everything, that's so amazing that you've shared that. Now, so what I want to hold on, hey. Yeah, so the advice you give are really valuable with the breathing side, the relaxation side, and how you deal with your patients. I think that a lot of our listeners will find that very useful and practical to do, and that's maybe something that they can check with their dentist. If they are finding that they are getting some of these symptoms, or at least get these aspects checked so they know whether they are in the early stages of TMJ and get that managed before it becomes before it becomes bad, right? No, we don't want the joints to be worn out because that's too late at that time.
That's too late.
Yeah. So if you're noticing tension around your jaw, your neck, or shoulders, don't ignore it. A few small changes in posture, stress management, and muscle care can make a huge difference. So, Dr. Baol, thank you so much for sharing your time and insight today, and for helping us to see the jaw is so much more than just teeth. Before we wrap it up, are you able to give us one practical tip that you recommend, because we cover so many things today? So if for our listeners out there who are suspecting that they might have TMJ issues, that is, maybe they're getting jaw pain, maybe clicking, maybe headaches. What's the one tip that you can share with them that they can get started today?
I think it loops back to what saved me and my dental career: mindfulness. Because it extends beyond the TMD. It covers everything, and bringing that awareness of mind and body. So mindfulness can start in the split second. Just stop, pause, breathe, and bringing your awareness to your breath. Breathing in, I know that I'm breathing in, and follow that breath to your belly, and breathing out, knowing that I'm breathing out, and follow that breath out. And that's a moment of mindfulness. And a moment to get you connected with yourself again. And the breath is so valuable because it's there with you all the time. If you don't have it, you're dead. So you don't need any external help or environment. So even if it's not physical pain, even if there's a moment where you feel like I can't or you're stuck, then pause and breathe. Because I can assure you, after your third breath, you will feel different to when you felt before you did your breathing. So I think mindfulness is it's funny to call it mindfulness, and trending. So it feels like, it's just a bit of mindfulness, but maybe we should just bring it to awareness of the breath, awareness of being alive, awareness of my body. So that for me saved my life and saved my dental career. And it's how I approach everything in life and in work. So breathe, everyone, mindfully.
That is amazing. Something that is so easy to do and so easy not to do.
Yeah.
And when you do it, it does make a difference. And definitely over time, you can see that it does bring tremendous value. So thank you to our listeners for tuning in. If you found this helpful, don't forget to subscribe and share this episode with someone who might be clenching their way through their stress right now. Until next time, stay mindful, stay mobile, and keep moving well.
Thank you. Thank you for having me.